The health department says it is expecting another batch of Mpox vaccines next week. The first, consisting of 10 doses, arrived this week. The number of confirmed cases is now at 13, with 7 infections recorded in KZN. Gauteng accounts for 5 and the Western Cape has 1 case. 2 people have so far died from this disease. The department's Foster Mohale says the vaccines will be used for patients who experience severe complications as a result of the disease.
It's about 10 doses. As I indicated, that even the first 13 cases that we are treating, not all of these patients, they experience severe health complications. So hence, I know someone will say, no, why only 10 doses? This treatment is not readily available across the world because this disease is not endemic in most countries, meaning that it's not commonly found in most parts of the world. And remember, during the time of COVID, we struggled to access the vaccine. But through preventative methods, we can curb the spread of this infectious disease. But for those who suffer mild complications, we're able to continue to use other treatment that we've been using, like a treatment to manage your fever, your infections, your headache, and so forth, including the smallpox or chickenpox, because these are related to health conditions.
The Tshwane Metro, in partnership with Mpathy clinics, have launched a new healthcare facility. The clinic will cater for low-income households. Newzroom Africa's Zola Sholwana reports.
With only a small minority of the population able to afford excessive costs of private healthcare, the current burden on the national healthcare system has significant consequences on those who cannot afford to pay for private healthcare. Statistics show that at least 84% of South Africa's population is solely reliant on public healthcare. The collaboration between the City of Tshwane Department of Health to launch Mpathy Clinic aims to bridge a healthcare gap and cater for those who have financial hardships.
My vision at the beginning of my term 2 years back, I said I want to bring health services closer to the community members. Some of the areas are really far away from current clinics, and they have to travel with public transport, and that's also very expensive. So they travel from places like Winterveld to other areas to go and see the clinics and get their medication from. This clinic is in an area where there's a really also very poor people staying, and I thought let's pilot it here in Pretoria North and see how well it works.
This facility will offer a variety of healthcare services.
The services that will be offered here are mainly primary healthcare services, mother to child, so all the immunizations, antenatal and postnatal care, curative services. We will also be doing HIV testing and counseling, TB screening and treatment and chronic disease management.
At an affordable fee.
Fees are quite low. We are charging between 100 Rand and 300 with an average of 150 generally speaking. But for children, we're not making them pay anything more than 100 Rand.
Despite the constitutional guarantee of access to high-quality healthcare, thousands of patients visit primary healthcare clinics and hospitals across the country daily, only to be turned away after enduring lengthy wait times. Tshwane residents say this facility will improve their lives.
malwetse a farologaneng a ileng gore a re ama ka tsela tse dintsi bontsi ba batho ba na le tshokolo ya gore ga ba ya mo ditleliniking tsa mothalo o ntseng fela yana di re fa matsapa in terms of go kry-e le gore ga bana ditšhelete kgotsa ga bana bokgoni bo bo ka etsang gore ba kgone go ka tlhokomelwa gore maphelo a bone a nne a feleletseng.
E tlo thusa haholo for batho ba ile gore ga ba afford and le ba avoided the long queues, the more public clinics, because sometimes they do want to consult with private clinics because of Habana Chelete, then they fail. I think it will assist because I understand they're going to, the chronic also, they will be able to assist us on about chronic.
Mpathy Clinic aims to establish 70 clinics nationwide in the next 5 years to provide critical healthcare services to underprivileged communities. For Newzroom Afrika on Channel 405, I am Zola Sholwana in Pretoria.